Now to your community focus. Every week, Governor Gina Raimondo joins us here on 12 News Now at 4 to give an update on the state's COVID-19 response. This week's exclusive one-on-one comes as Rhode Island prepares to enter a 2-week pause. Kim Clunian joining us live at the State House, where she just wrapped up that interview.
Yeah, Brian, a lot of ground to cover. As you mentioned, we are just a few days away from the start of that 2-week pause, which begins on Monday, and we're also fast approaching this holiday weekend. And of course, today we saw another rise in hospitalizations, the highest number that we have seen since early May. So I asked the governor today about that rise in cases and hospitalizations, and also how this 2-week pause is going to impact not just people's public health, but the local economy. Here's a piece of our Governor, thank you for being with us.
Happy to be here. Happy Thanksgiving.
Yes, happy Thanksgiving to you. Unfortunately, with Thanksgiving week, I don't want to start with bad news, but we got more bad news today in terms of the hospitalizations. They jumped to more than 320, the highest we've seen since early May. Is it your understanding that as early as next week, we could see patients being admitted to one or both field hospitals?
Yes, it's possible. We are readying both hospitals, and both will be ready for next week. Whether we need them or whether the hospitals decide to go live is the hospital's decision. But yes, absolutely. We had the most hospitalizations I think ever yesterday, 50 plus new hospitalizations. The rate of increase of hospitalizations is the fastest we've ever seen, faster than at any point in the spring. So yes, that's a definite possibility.
With all of the restrictions that you've been putting in place over the past weeks, is it frustrating, angering, alarming, all of the above to see the case numbers and hospitalizations continue on this upward trend?
Yeah. Let me say, it isn't surprising because people had a lot of Halloween parties. We saw that in the data. Lots of at-home Halloween parties, continuing to have birthday parties, hanging out with the friends around Halloween and such. So we knew that that would translate into what we're living with now. Is it frustrating and disappointing? And yeah, absolutely. Last week I had to make a really tough decision, which is going to put a lot of people out of work. Bars are closing for 2 weeks. Gyms are closing for 2 weeks. It breaks my heart to have to do that. But if folks are not going to, stay at home, wear their masks, cut down on their parties, then unfortunately it's where we have to go. So I'm hopeful for the pause. I really hope Rhode Islanders take it seriously. I'm hopeful people are going to follow the rules for Thanksgiving. It's just getting real now. We're going to be pretty soon at a point where we're all going to know somebody in the hospital, and then it's going to get real for people.
In terms of the 2-week pause, which begins on Monday, 2 state representatives are calling into question your decision to close gyms. I think some people say, listen, I go to a restaurant, I take my mask off, I can keep my mask on while I'm inside at the gym. Can you walk us through again why that decision has been made and if you are reconsidering it? Yeah,
I am not reconsidering it. It's a tough decision, and tomorrow at the press conference I will be rolling out economic aid for the businesses like gyms that are going to be affected in the pause, because I know it's really difficult. Let me first begin by saying there's no easy answer, no perfect answer. And we are asking bars to close, and we're cutting back on restaurants. With respect to gyms, it's not just in Rhode Island, but the CDC has collected data from around the country. When you're at the gym, you're walking around, you're not stationary. Lots of people can't keep their mask on. People are breathing heavily, exhaling, etc. So we just thought it was prudent to put them in the category for the 2-week pause. It's all indoors. These are the things we want to try to avoid. Indoors, people gathering, moving, breathing heavily.
On the topic of small businesses and assistance for them, there's a rally scheduled for tomorrow morning calling on you to release an additional $150 million from the CARES Act money in the form of grants. Is that something you're going to do, or will the program you're announcing tomorrow look a little bit different?
It'll be substantial. We're still doing the work to figure out exactly how and how much, but it's going to be very large, and we're going to get it out the door as quickly as we can because, as I said, businesses are struggling. I will say I know some people have been critical that I've held back some of the CARES Act. I'm so happy I did, because now we're racking up the bills. Field hospitals are very expensive. Getting ready for the vaccine, very expensive. Putting money out the door starting tomorrow to businesses. So it was a good move, I think, to hold back some so that, it's there because we need it. Thank God we still have it. I've talked to some of my fellow governors, they don't have any left, and I'm so grateful we still have some money left.
And again, that was just a small portion of our conversation. Coming up on 12 News Now at 5 and 6, we'll also talk about how long the governor thinks this pause will actually last, whether she'll extend it, and how and when she will make that decision, as well as where people might be able to get that COVID-19 vaccine once it is available. Brian?
COVID-19 hospitalizations are once again rising here in Rhode Island. Good evening. I'm Mike Montecalvo.
And I'm Shannon Heggie. The Department of Health says the total number of hospitalizations has climbed to 323, the most since May 5th.
This number includes 30 in the ICU. 16 more people have died after contracting COVID-19. The overall death toll is now more than 1,300.
812 new positive cases were reported today for a daily positivity rate of 7.2%. 12 News reporter Kim Kalunian is live at the State House, where she just finished speaking with Governor Raimondo.
She joins us now with the latest on what the governor is saying about the ongoing pandemic. Hi, Kim.
Hi, Mike. Hi, Shannon. Yeah, the governor today telling me that hospitalizations are rising faster now than they did in the spring, and she believes that we will soon be at the point where all of us know someone who's in the hospital because of this virus. She also told me this afternoon it, quote, breaks her heart to close businesses during this 2-week pause, but she also believes it is a necessary evil. Of course, there is some light at the end of the tunnel as we see some promising news on the vaccine front. So today I asked the governor how and when folks will be able to access that vaccine once it is readily available. Here's what she had to say.
There'll be very few vaccines this year. So we are hoping we'll have some vaccines by the end of the year. It'll be very limited supply and go to healthcare workers. So if you work in a hospital or you're a healthcare worker in a nursing home, we will let you know, and we will find you at your place of work, and we will try to vaccinate you. The broad scale vaccination, where the average Rhode Islander could hope to get vaccinated, isn't going to happen until like early spring. And we are right now trying to answer your questions. We are trying, the mantra is as easy as possible. And that means there's going to be a lot of different outlets. Maybe you could go to a grocery store, maybe you could go to a pharmacy, maybe you could get it at your place of work. So we're working through all those details right now in concert with the federal government. For this year, it's still going to be very limited and focused on hospital workers, nursing home workers, healthcare workers.
And again, on the topic of the 2-week pause, we know that that will begin on Monday, but today I asked the governor when and how she will decide whether she will be extending it past that 2-week time frame. We'll have her answer to that question coming up new at 6. For now, reporting live at the State House, I'm Kim Kalunian, 12 News.
The Rhode Island Department of Health says the number of people in the hospital is now well above 300.
Tonight, we've obtained data from the health department showing just how full the state's hospitals are. As of today, more than 95% of the clinical beds at Rhode Island Hospital are full, along with 89% of the ICU beds. Kent Hospital only has one ICU bed open, and 88% of its clinical beds are full. And all of Miriam Hospital's ICU beds are full, along with 95% of its clinical beds.
The hospital situation is one of several topics 12 News anchor Kim Kalunian talked about one-on-one with Governor Gina Raimondo today, along with the upcoming 2-week pause aimed at keeping the hospitals from getting overwhelmed. Kim?
Well, Shannon and Mike, the governor telling me today it, quote, breaks her heart that she's going to have to close some businesses during that upcoming 2-week pause, but those hospitalizations, a major reason why she's taking this action. She told me today that hospitalizations are rising faster now than they did back in the spring. And she told me today she'll be announcing some new assistance for small businesses at her press briefing tomorrow, calling it substantial funding. Meanwhile, the governor has said the 2-week pause might be extended. So I asked today how and when she will make that call. She told me she'd decide at the end of the 2 weeks and use some specific data to inform her decision.
It has been shown that Google mobility data and other forms of mobility data is actually a pretty good predictor of future spikes. So we're going to be tracking that, and if at the end of a couple of weeks we see a precipitous decline in mobility, then I'll have some confidence to turn up the dial. By the way, it's not a light switch. We're not going to say everybody go out to eat. It'll be turning up the dial. If at the end of the 2 weeks we're not really seeing a change in mobility, yes, we will extend it or maybe even do more.
And the governor's press briefing is scheduled for 1 o'clock tomorrow. You can watch it live right here on WPRI 12. We are not expecting her to announce any further restrictions, but again, we are expecting her to have some news around new assistance for small businesses. In the meantime, you can watch my full conversation with her right now on WPRI.com. Live at the State House, I'm Kim Kalunian, 12 News.